And I'll say something else that I think is very important. I believe there's another pandemic coming, and that's the pandemic none of us are really talking about. And the second pandemic is the pandemic and the crisis in healthcare of individuals who've been isolated, who've started to drink too much, who've really become depressed, who have less access to mental health care. And I worry that there is a second pandemic coming, and no one has yet prepared for that.
A silent pandemic.
Yes, a silent pandemic, but just as deadly a killer.
And just
And I
as loud.
think that really, yes, just as hard. And in underprivileged and communities, this will be a market problem. And I think that also our desire to get back together may actually in some ways trigger even more drinking, or trigger more partying, or if you like, trigger more of the behaviors that may not only spread the virus, but may also bring about the second pandemic, which I really hope does not appear in full force, because that is something we're not prepared to face. We do not have large amounts of people trained in the management of alcohol and drug addiction in the United States, and we do not have the facility or the psychological help for these individuals. So this is really a very important point in history where we should learn from our mistakes and move towards developing better treatments to combat the second pandemic that may be coming.
Dr. Johnson, we really appreciate you joining us tonight on BNC, and we more importantly appreciate your insight, and we look forward to talking to you again and welcoming you back to discuss this potential second pandemic you spoke of tonight. Thank you again, sir, for joining us.